Hi everyone, my name is Anthony Josué Conmena, and my topic is safety and efficacy of bempedoic acid to reduce LDL cholesterol. Definition: exist two types of lipoproteins carry cholesterol to and from cells. The first one is LDL or low density lipoproteins, and the second one is HDL or high density lipoproteins. LDL cholesterol is considered the bad cholesterol because it contributes to fiery buildups in arteries, arteriosclerosis. This condition narrows the arteries and increases the risk for heart attack, stroke, and PAD or peripheral artery disease.
If you or someone you know has been diagnosed with high cholesterol, it's important to understand what cholesterol is and why it's important to keep it under control. Cholesterol is a fat-like substance made by your liver and also comes from foods you intake that is then packaged into particles called lipoproteins. Your body needs cholesterol to make hormones, vitamin D, and a substance that helps you digest food called bile. This video discusses two types of lipoproteins that carry cholesterol: low-density lipoprotein, or LDL cholesterol, also known as bad cholesterol, and high-density lipoprotein, or HDL cholesterol, also known as good cholesterol. LDL travels through your bloodstream, delivering cholesterol to the cells that need it. If your body has too much LDL, it can build up in the walls of your arteries. LDL and other substances in your artery wall form a fatty deposit called plaque. Over time, plaque can narrow the artery and reduce blood flow. LDL carries cholesterol into the plaque. This is why LDL is called the bad cholesterol. A common place this plaque can build up is in your coronary arteries, which are the blood vessels that feed your heart. This plaque buildup causes coronary artery disease and increases your risk of a heart attack. Plaque buildup in other arteries, such as the carotid arteries in your neck, can reduce blood flow to your brain and increase the risk of a stroke. Your liver also makes high-density lipoprotein, or HDL, also known as the good cholesterol. HDL helps remove excess cholesterol from your cells, tissues, and from plaque in your blood vessels. This is why HDL is called the good cholesterol. HDL returns the excess cholesterol to your liver, which removes it from your body. If after viewing this information you have questions about cholesterol or any medications you've been prescribed to help manage your high cholesterol, speak with your healthcare provider. It is important to take your medications as directed by your provider and report any side effects you experience.
Application in medicine. Lipid-lowering therapies, primarily statins, have somewhat reduced the burden of CD or cardiovascular disease. However, extended therapy alone is often used to achieve the appropriate lowering of the LDL cholesterol level. Therefore, there is a need to develop additional therapies, such as bempedoic acid. Bempedoic acid has been shown to lower LDL cholesterol level with inhibiting ATP citrate-lyase, a key enzyme in the cholesterol biosynthesis.
Bempedoic acid, a cholesterol buster, revolution in targeted therapy for lowering LDL cholesterol. It is the very latest drug approved by FDA in February 2020, and it has been developed by Aspirin Therapeutics as Nexletol. Today, clinically, we are using statins as a drug of choice for treating hyperlipidemia. But in US, there are approximately 3 to 7 million patients that have stopped statin treatment despite they are at a risk of cardiovascular disease. Why? Because statins are associated with myopathy and it causes the patient the myalgia, muscle cramps, muscle pain that will decrease the compliance of the patient and causes dose limitation. So there is a need of a drug that especially for those patients, so there is a need of a drug especially for those patients who cannot achieve adequate LDL level in their blood. So bempedoic acid is a small drug molecule that has been developed for the treatment of hyperlipidemia, especially for those patients who are statin intolerant, who cannot tolerate statins.
Pros and cons. Pros. The additional reduction in the LDL cholesterol level with bempedoic acid therapy was added to moderate intested standing therapies greater than 6% reduction that has been current in the literature with doubling the dose of a statin. Cons. Bempedoic acid is a prodrug and requires activation by the enzyme very long chain acyl-CoA synthetase. Bempedoic acid is known to be associated with the modest elevation in the uric acid level.
If we talk about its warning and precautions, so they are two: hyperuricemia and tendon rupture. Hyperuricemia. Bempedoic acid causes hyperuricemia. How? It's because it inhibits the excretory mechanism of uric acid in our body. It inhibits OAT2 transporter that is present in our epithelial lining of PCT, proximal convoluted tubule of loop of Henle. As a result of which, the uric acid cannot be secreted into the tubule, into the kidney, and there is a high level of uric acid in the blood that causes hyperuricemia. And this hyperuricemia can even lead to gout as well. So we have to assess and monitor periodically the level of uric acid in the patient, and if there is a symptom of hyperuricemia, we have to use the urate lowering drugs to modulate the level of uric acid in patient. Second one is tendon rupture. Firstly, what is meant by tendon? A fibrous tissue that connects your muscle to a bone, and bempedoic acid causes tendon rupture. So discontinue it if there is a tendon rupture occur, and avoid in those patients that have a history of tendon rupture. Adverse reactions. The adverse reactions include upper respiratory tract infection, muscle spasm, hyperuricemia, back pain, abdominal pain, bronchitis, anemia, and an elevated liver enzyme. If we talk about its drug interaction, so if there is a concomitant use of bempedoic acid, simvastatin greater than 20 mg or pravastatin greater than 40 mg, it causes synergistic effect of myopathy. In pregnancy and lactation, bempedoic acid is not recommended.
Issue applied in Ecuador. In Ecuador, according to the insult survey, in effect, 24.5% of people between 10 and 59 years old. In most cases, it is a genetic condition, but 20% of the cholesterol that circulates in the blood is the result of the food that is consumed. For this reason, it is imperative to know the types of treatments that exist to treat this condition, and additional treatments will be good combination to obtain satisfactory results.
Number 8. Bempedoic acid for cholesterol lowering in statin intolerant patients.
High cholesterol is a major concern for nearly 40% of American adults. The fat-like substance is necessary for the body to function. but too much low-density LDL cholesterol can lead to buildup in the blood vessels, which can cause a heart attack or stroke. While several medications exist for treatment, statins are the most popular, but the prescription comes with some adverse side effects. Statin drugs enter muscles, causing muscle pain in approximately 5 to 10% of people who take them. A new agent, Bempedoic acid, has been designed as a once-daily oral therapy, given in addition to a patient's current cholesterol medication regimen. Like statins, bempedoic acid works by blocking a key enzyme used by the body to make cholesterol. But unlike statins, it cannot accumulate in muscle, reducing the likelihood of muscle pain. In clinical trials of the therapy, patients saw their LDL levels drop by an average of about 25%. If approved by the FDA, bempedoic acid could be another addition to the arsenal of cholesterol-lowering treatments available to patients.
Conclusion. The treatment with bempedoic acid, an inhibitor of ATP citrate release, added to the maximally tolerated stent therapy that does not lead to a ginger overwhelming series of adverse events and led to significantly lower LDL cholesterol levels.
Not only do statin drugs lower LDL cholesterol, but more importantly have been shown to substantially reduce the risk of having a heart attack or dying from heart disease. In fact, for every 10-point reduction in LDL cholesterol, there is an approximate 10% reduction in cardiovascular risk. Consequently, lowering LDL cholesterol with statin therapy remains the primary treatment in patients with dyslipidemia. Statins are well tolerated in most individuals, but as with any medication, there are side effects which may limit their use. The most common side effects associated with statin therapy include gastrointestinal intolerance, such as nausea or bloating, upper respiratory symptoms or headache, liver abnormalities, and muscle aching. And more recently, there's been an association reported between statin use and the development of diabetes and potentially memory loss, although a little less better substantiated. Now let's look at the more severe adverse events and look at how commonly they occur. Liver abnormalities, fortunately, occur in less than 1% of individuals who take statins, are usually transient and may go away if you stop the medication temporarily or even continue it at lower doses, and in addition rarely leads to any type of liver dysfunction. Muscle symptoms such as myalgia or muscle aching occur in approximately 1.5 to 3.5% of individuals. Fortunately, myopathy, muscle injury, is very infrequent, occurring less than 0.1% of all individuals who take statins. Now, fortunately, these side effects are infrequent in patients, but there are still some individuals who experience side effects and may limit the use of a medication which has been proven to be effective in reducing cardiovascular disease.
Thank you.